Understanding Blepharoplasty, a guide to upper and lower eyelid surgery. Let's start with the upper eyelids. Many people experience heaviness in their upper eyelids due to excess skin, which can affect their appearance and sometimes even their vision. A common treatment for this is upper blepharoplasty, a procedure designed to remove excess skin for both functional and cosmetic benefits. We'd start by discussing your specific needs and any existing eye conditions, like dry eyes, as well as checking to see if insurance coverage is relevant. For example, one of our patients was kind enough to share her experience to illustrate the process. Her goal is to remove excess skin to improve her field of vision and enhance her appearance. During the procedure, Dr. Patel will measure the excess skin carefully, typically marking in small increments, usually about every 5 millimeters, where the skin will be removed. It's normal to have slight asymmetry between the eyes, which he will account for improving symmetry. Most isolated upper eyelid surgeries, about 78%, are done in the office with local anesthesia, along with oral medication for comfort. However, the option to use an operating room with twilight or general anesthesia is also available if you prefer, or if local anesthesia has been an issue for you in the past. If lower eyelid surgery is performed at the same time, we can discuss which setting is best during consultation based on your goals. The surgical process. After numbing the area, Dr. Patel will remove the extra skin and then apply sutures. These stitches stay in place for 5 to 7 days and will be removed in office. Recovery is usually quick, with minimal bruising and swelling. You can use makeup on areas outside of the incision line starting 3 days after surgery. At about a week, most people are back to their usual activities. The exception is heavy lifting and exercise. He will have you wait until day 10 after surgery. Here's a typical progression 1 week after surgery. You can already start to see the improvement, which looks natural. Here is another example. She is 2 months out from surgery, and she looks refreshed, and the results appear natural. Now, she underwent a full-face CO2 laser therapy at the same time to treat precancerous lesions and to improve overall texture and tone. Combination therapy with lasers and fat grafting is common and a great way to achieve a natural result. Let's move on to lower eyelids. Lower blepharoplasty can help reduce puffiness, bags, hollows, or wrinkles under the eyes by addressing fat pockets and extra skin, resulting in a smoother, more youthful look. Lower blepharoplasty can also be performed in office, depending on the complexity of the treatment and your comfort level. Here's an example of a patient who underwent lower eyelid surgery to address 3 common issues. First, she had excess skin that caused makeup to settle into creases. Second, she experienced puffiness or fat bags, which occur as the membrane holding the fat weakens with age, allowing fat to protrude. Third, she had tear trough hollowing, a hollow area below the eyelid at the junction of the cheek. To treat her puffiness, Dr. Patel made a nearly invisible incision behind the eyelid and removed the excess fat. For the hollowing, he performed fat grafting by extracting fat through liposuction from her abdomen, thighs, or another agreed area. He will process the fat and carefully place it into the hollow area. In some cases, he may use the patient's own fat pads and transpose them to fill the hollowing, a technique called fat transposition, but in her case, we used micro-fat grafting. As you can see in her after photos, she looks rejuvenated. The fat pads and hollowing are improved, giving her a natural, impactful result. Here's another patient who had both upper and lower eyelid surgery. His fat pads were sculpted and hollowing improved, achieving a more refreshed look. Lastly, insurance eligibility. If excess skin on the upper eyelids is obstructing vision, insurance may cover the procedure, reducing or even eliminating out-of-pocket costs. To determine eligibility, Dr. Patel and his team will coordinate a peripheral field test with an eye doctor. This test measures your vision at rest with your upper eyelid taped up. If the visual field improves significantly with the taped-up eyelid, insurance might approve the surgery, and we will help you with the insurance approval process.